And I'll go ahead and read. Dr. Sellers educated is approved as a provider of nursing continuing professional development by the North Carolina Nurses Association and a accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. To receive contact hours, you're required to stay for the entire program, watch the full recording, and complete the evaluation. And evaluation will be at the end of our 6-week session. You will receive an evaluation in your email, and we do encourage you to complete that complete the survey, complete the evaluation so that you'll be able to get your continuing ed hours for attending the 6-week session, either in the platform or going back to watch your videos. I hope everybody's doing well today. We have a guest joining us today. She's not a guest to me. You're going to get an awesome opportunity to meet one of my mentors in simulation, Miss Angeline Baker. I told you we were going to do some test taking strategies. I was going to add that to the top of our time in the place of the Sim Dictionary terms. I will send you out an email with some Kara had asked last week about terms. Do we have a list of terms that would possibly be on the CHSE? I know there's a strong reference to the simulation dictionary itself. It has a lot of terms in there, but I did find some documentation that I will put in an email that you'll see some of the common terms that we may see on the CHSE. And I'll try to get that out to you later tonight. And that way you'll have it in your toolkit. And I'll also try to upload it to our folder as well, so you can have access to that. So hopefully that'll help. But we're gonna let Angeline, Miss Baker, introduce herself and
just a minute, Miss Scott. I'm trying to find you guys.
Okay, we hear you.
I know, but for some reason you're off my screen. Wait a minute.
Okay.
Let me find you because I know you're here.
Yes, ma'am. And while you're doing that, we're gonna let everybody check in. Hi, Artie. How are you doing today?
Hi, God. I'm doing great. How are you?
Good, good.
Where are you?
Huh?
I can hear you, but where are you?
Oh, okay.
It is like I lost you guys. I may have to close out and start back over because I lost you.
Make sure your video is
okay.
Yeah.
Okay. I can hear you. I can hear you. But
I hope Amanda's doing well. She wasn't feeling well either, I think, our last session. So I hope she's doing well. I'll reach out to her. I know we have one other of our team members there actually. NASCO starts this week. Anybody going to the NASCO, the simulation conference in Denver?
No.
Okay. All right.
I went
a few years ago when I was in Rhode Island, because that's not too far, but hopefully I'll get back there again sometime. It was pretty good.
Yes, I'm excited. I'll be leaving on Thursday. So excited. It was in my town, my city last year was in Raleigh. So that was my first time going when it was here last summer. So I'm looking forward to going again. That's one conference I think that all of us should at least try to go to. It's really, really good. You get to, meet a lot of people, get to learn a lot about simulation. So if you haven't, I think most of us have. Lorenza, you've been as well, right?
Yeah, I've been at least 3 times, but this year now, because I went to IMSH this year, they can't fund both at the same time. That IMSH was so expensive,
It was. Oh my gosh, that was something big. That was my first time going to IMSH at the top of the year. That was a lot. It was a lot.
But it was a big one too,
Yeah, everybody.
In NASCAR, yeah, it's a big one.
Yeah, everybody in healthcare, sim ops, text, everything. So it was really, really big. That's another one that's a good one to go to at least once, and I think it's what people will like. Everybody like different things, that different environments. It's not really all nurse centered or yeah, so it was different. It was different.
Yeah.
Okay. But Scott, I think
Uh-huh.
sorry.
You got us? Did you find us?
I found you.
Well,
Hi,
we're gonna go ahead and get started. We have a few more minutes, but we'll go ahead and get started. Again, I'd like to introduce Miss Angeline Baker. I'm gonna let her introduce herself and tell just a little bit about herself. She's gonna do a nice little test taking strategy, and I thought that would be very good to add to my prep sessions. That will just even make it that much more stronger for our participants. And she is a champion and an expert in the area of test taking strategies across the board. So I did invite her in, and I think it's going to be a really good addition to the CHSE prep course. So, Ms. Baker, I'm going to turn it over to you.
Okay, if you'll share the
Okay, let me
screen.
stop sharing. I'll stop sharing, and then you'll be able to share.
All right, can everyone see the screen?
It's not coming over yet. Let's see. We'll give it a few moments.
Because I can see it on my end. Can you still can't see it?
No.
Okay, okay.
Oh, now it's starting.
Okay, can you see it now?
Uh-huh. Uh-huh.
Okay. Well, good evening, everyone. My name is Angeline Baker, and as Dr. Scott mentioned, I have been a nurse for quite some time, over 40 years of experience. I worked 25 years in a hospital setting. I worked 12 years at North Carolina Central University. I was the simulation coordinator for North Carolina Central from 2007 to 2018 when I retired. And Dr. Tina Scott was able to take over that position. And she has truly done some outstanding things since she has taken over the reins. And I'm very happy to be with you. I did retire from North Carolina Central University. And right now, presently, what I am doing is I am working with students taking the NCLEX exam. So I work with graduate students who are testing for NCLEX. And that has been one of the joys of my career so far right now, just to see the young nurses get their license and start practicing. So, and I'm very excited also now to spend some time to talk with each one of you and share some knowledge with you, especially about test taking strategies, because it is all about the test. Okay. Anyone have any questions? And the thing I tell everyone, because y'all are adult learners, y'all are doing simulation, you're in the throes of simulation, you know what you're doing. And when you are answering the questions, it is really a process of elimination for you and trying to figure out what they're asking and what is the right answer. And let me just say, when you're answering questions, the first thing you need to do is read the questions carefully, then reread for clarity. Then examine every answer choice. Don't just see one choice and say, I know that's the answer. Read all the choices just to make sure. Then look for proof in the choice. And then always check and think. Am I answering what they're asking? The question is asking. And now what we're going to do is I thought it would be good to go over one question. Can you see the question? A
Yes.
simulation educator begins a pre-briefing session by asking the learner to recall information from previous sessions before providing them with information for an upcoming simulation activity. The simulation educator is enacting which educational theory? Constructivism, behaviorism, scaffolding, or realism? So write your answer down. Anyone want to share their answer before we go to what I think the answer is? Anyone want to share their answer?
They're putting it in the chat. So far, we
they
have
are?
A. Uh-huh.
Okay. So far, A. The answer is A.
Woo woo.
Constructivism. Now, tell me why behaviorism was not correct. Because you got to know why the answer was not correct.
So,
Because constructivism is what? Relating past experiences to new experiences. Behaviorism is knowledge being demonstrated in a behavior. Scaffolding is building on previous knowledge. You become a novice to an expert nurse. Realism is theory, philosophy that science can build on the knowledge. So you are absolutely correct. Question number 2. Learner is trying over and over to gain skill in practicing a nasogastric tube, placing a nasogastric tube using a task trainer. The student is displaying which concept of Cobb's experimental learning theory? Concrete experience, abstract conceptualization, reflective observation, or active experimentation? Y'all putting it in the chat?
yeah.
Yep. Mm-hmm.
What answer did we come up with?
A. They put A.
They put A.
Mm-hmm. And then wait. D.
Okay. Keep.
Hold on a second.
A learner is trying over and over to gain skill in placing a nasogastric tube using a task trainer. Okay. So the answer to question 2 is active experimentation. Why? Because she's doing it over and over again. She is trying to do that. So D is the answer. Okay. And then you want to ask why, right? Why? Okay. Concrete experience is learning about things that are tangible, things you can put your hands on, things you can touch, you can feel. Abstract conceptualization is taking in learning affect perspective. So that's taking in information and learning it. Reflective observation is thinking about learning before reacting. You're reflecting what has happened. You're reflecting back and looking back. But active experimentation is what? Practicing a skill. So that's what makes that the right answer. Any questions? And I just want to talk about Cobb's theory because it is actually what you're doing right now in your practice. It is importance of active engagement and reflection in the learning process. That's what simulation is really doing. You are really being actively engaged and reflecting in the learning process. That's what we all do every day when we're learning something new. And Cobb's theory is a process of transforming experience to knowledge. Concrete experience, engaging in activity. Reflective observation, observing and reflecting on experience. Abstract conceptualization, drawing and creating a model or theory based on reflection. And active experimentation, applying new knowledge or theory to new situations and testing concepts. I might be getting ahead of myself, but it's ready, set, test. And that's what y'all are doing now. Y'all are gathering information and answering tests weekly. You are going back and reflecting on your knowledge that you learned the week before and any additional readings that you have now. So you're doing that. You're getting ready, set, and you're going to test. So before each time you are taking the test, while you're learning, take a deep breath and relax. Make sure that you are in a quiet space. Don't rush. If you have 20 questions to answer tonight, don't rush through it. Relax. Do those questions in a quiet environment. Read all the directions very carefully. Read the questions carefully because they always try to trick you with different kinds of questions, right? Because sometimes they'll say Miss Jones never does something. And that should bring up a red flag when somebody never does something. or somebody says always, we always know that. That's one of those red flag moments. And you can always paraphrase the question for your understanding. What is it actually saying to me? What is the question asking of me? And then you always eliminate the answers you know are wrong. When you know an answer is wrong, you just go ahead and strike that off. And we all know, and this is what I tell everyone, tests are just a way of letting your knowledge shine. You all know this information. You just have to put it into your words so when the question comes before you, you can answer it. But you're practicing. You are doing this. So therefore you know it. Now you're going to have to label it. You're going to have to put a name to it. But let your knowledge shine through. Now, do you have any questions or any thoughts? And this was just a small snippet of what I do when I do teach a lot of adult students information. So this was just a small snippet of the information. So I'll entertain any questions that you have about this exam. No questions? Miss Scott, I think you're doing a great job. There are no questions. Which chapters are y'all studying tonight?
We are on chapter 14, and guess what? It's on theories.
Oh, okay.
Yeah, so they're going to make 100 because guess what? The first few questions is about constructivist, experiential learning, COBS, and all that good stuff. So you were right on point.
All right. Oh, well, then they're ready.
Yes. Ready. Thank you so much, Miss Baker.
you.
And
You're
I
quite
just
welcome.
wanted
Thank you so much. Thank you.
You're quite welcome. Thank you.
Yes. So she said a lot of good things. And guess what? We'll keep talking about it as we continue. Can you believe this is session 4? We only have 2 more sessions left. It has
Oh,
gone
that is
by.
wonderful.
It's gone by really, really fast. But what we'll do is we'll keep, encouraging you. And when we go over our questions, that was one of the things we often talk about. Tell me the why. Go back and tell why, all of your answers are correct. Or, I mean, not all of you, all of the answers that are correct, you need to know why. And the answers that are incorrect, you should be able to tell why that answer is incorrect as well. And don't forget to look at your question. And as she was stating, what is that question asking me? So we'll continue to role model that as we finish out our next couple of weeks. And I'm always going to still be available to you even after we finish our 6 weeks. So if we ever just need to do something off to the side, just email me and we'll make time to do that as well. Okay.
I have one question for Miss Angela. Is it possible to share your little test taking strategy PowerPoint with us?
Well, that'll be up to Dr. Scott. It's fine with me. I mean, it'll be up to Dr. Scott to do it, but she has my permission to share if she needs to. Yes, ma'am.
Okay. Well, I will put it in our folder. How about that? I'll put it in week 4, and that way you'll have access to it forever. Okay. Thank you, Miss Baker.
Thank you. Y'all have a good evening. Best of luck
Thank
to
you
all
for
of
allowing us to share it too. Okay. Hopefully she'll come back. We'll see.
Talk to you later. Bye-bye.
All right. Thank you, Miss Baker.
Bye-bye.
Did you stop? Okay, she did.
Yeah, I
All
stopped
right.
sharing. I'm gonna exit out.
All right. So we'll go ahead and go. We're right on target with our time. Let's see. So here we are with our agenda for tonight. In the place of the dictionary terms, we did the test taking strategy on tonight. And I will send that document over about most frequent words out of the dictionary, out of the SIM dictionary that we will see on the CHSE exam. I'll be going as well to NASCO. If I pick up any new tips while I'm there, you best believe I'll be sharing those with you when I come back. So I'll send you some emails or anything that when I go to conferences, if I find anything that I think will be helpful for our CHSE prep, I always try to bring that information back as well. Okay. All right. So we'll go ahead and get started. We're in chapter 14 tonight. You do have a resource on your folder. I was able in the last cohort to actually we were able to create a nice resource document that I think would be very beneficial to you. You should see it on the screen and it's inside of your folder as well. And I kind of hint to it a little bit in a few sessions prior to this one, is that the learning the theories is one thing. You can memorize the theory, but when you get to the test, you may not see knowledge questions about the theory. You're going to see more of a scenario like we're going to see tonight, and then you'll have to pull out, what concept, what theories they're asking, or what type of simulation are we doing, what are the facilitator doing, the learners, et cetera, et cetera. So learning it and memorizing the definition of the theory would not be where I would stop. You got to be able to apply that theory or see that theory in action when it relates to simulation education. So this document that you have access to, you'll see it there, and also has like an example to show you that theory in simulation. So you have that, you can use that, and hopefully it will help clarify and bring even some more direct understanding to the different theories. I went through and have most of them there and tried to add examples as well. So Patricia Brenner's, you're going to see that a lot. We've already talked about it a lot, but hopefully the examples that we have in this document will be very helpful to help you to connect the dot and actually see it in action. Okay, so I just wanted to bring that up, and then now we will go to chapter 14. Okay. And after we do chapter 14 tonight, we'll have a break, and then we'll do chapters 15 and 16, another break, and then we'll finish up tonight with chapter 17. Educational principles applied to simulation is our topic tonight. This one is one of the big sections on the CHSE exam. So what I did was I divided this up because I didn't want us to just go through this section fast. I wanted to kind of take our time because it's a lot, as you can see inside of this section 4. 40% of the CHSE exam is coming from section 4, educational principles applied to simulation. So make sure you give some true intentional efforts to the areas that may seem to be that may not be as clear. And theories tend to be the thing that I think for most of us, we just don't really spend a whole lot of time, unless we're teaching theory classes within our programs, if we're in academic settings, or a lot of us that are doing publications, you're having to have theoretical frameworks to support your research and your scholarly work. But other than that, a lot of times those theories we just kind of want to get through them. But for this section, you really have to know how those theories look like in action and simulation, and how they relate to sim and simulation activities. That's going to be chapter 14. Chapter 15, implementing simulation in the curriculum. 16, planning simulation activities. And then our last one of my favorites, is debriefing, chapter 17. Okay, so we'll go ahead and start looking at on page 237. Okay, and our first question, number 1, we ready? And we'll put our answers over in our chat box. Okay. A healthcare simulation educator is developing a scenario for a student to learn newborn care and would like to use the constructivist theory as the foundation. The best method would be A, have the student repeat a newborn assessment several times to get the procedure right. B, decide after pre-briefing the student's previous experience with newborns. C, develop a scenario that changes the newborn status if an assessment is performed wrong. D, change the newborn status to mimic a healthy newborn if the assessment is done correctly. Correct. B. Can someone tell me? Someone tell me why A is not correct. Why is A not the correct choice?
It's like deliberate practice, like repeatedly, you know. So I would say it's not that constructivism because it's fun.
Exactly. It's more geared towards which one? The behaviorist, right? Because the
Yeah.
behaviorist theory say, hey, if we can get them to change the behavior by doing this, we can change that behavior. So you're looking more in a behaviorist. So you're right. This one is more towards the behavioral aspect of the theories. Okay, great. Behaviorist. And what about C? Why is C incorrect?
Um, I would say situational theory aspect that the situation that is going on, but that's not what the question is asking.
Right. And it's not the tenet of the constructivist theory, right? Because the constructivist theory is going to what? Build. And I was able to remember it because to construct means to build. So you're building on the student's knowledge, almost like it's scaffolding, really, right? You build from where the students are, and then you come up and then you take them to that next level. So you start educating from where they are. Right. And C is more like cues, prompts on the fly. Yeah, you're right. You're right. It's not really structured. But
Mhm.
again, developing a scenario that changes the newborn status if an assessment is performed wrong. Again, it's looking at the vital signs to make sure that the students align to what the vital signs are saying. That's behavioral, right? And then D, change the newborn status to mimic a healthy newborn if the assessment is done correctly. Our correct answer is B. Decide after pre-briefing the student's previous experience with newborns. Okay. When we
Yeah.
look at our rationale, it says exactly what we just said. The constructivist theory should build on previous knowledge, and the teach and learning modality should be established to fit the student's learning needs. Understanding what the student's previous experience is after the simulation educator pre-briefs the student about the assessment is a good idea.
Yeah, because he's developing, it's in the process of developing that scenario. So he needed to kind of, I don't know. That's the way I look at it.
Yeah, and you're on to something because in our planning phase,
Yeah.
whenever you're planning and you're looking to develop your scenarios, one of the key things when we look at our NASCO's best practice standard, the standards of best practice, is that you have to do what? Know the level of your learners, right? And level that scenario in accordance to your learners, the level of your learners, right? Okay. Having the student repeat a newborn assessment several times to get the procedure correct reflects behaviorism through demonstration of repetition. And you said deliberate practice. Developing a scenario that changes the newborn status if an assessment is performed wrong, and changing the newborn status to mimic a healthy newborn if the assessment is done correctly. Again, is the behavioral theory, right? Stimulus response method. Looking at the behavior, trying to change the behavior by changing the scenario or changing something within the simulation. Good. Good, good, good. All right, number 2, the student needs additional understanding when they state a constructivist approach to this scenario includes A, using material we learned yesterday and applying it today. B, starting with what we know about this situation and then assessing the patient. C, approaching the patient as if we have no information. D, relating what is similar in this case to other cases we have worked through. The student needs additional understanding when they state a constructive approach to this scenario includes Correct. The answer is C, because that's saying they don't really understand. Approaching the patient as if we have no information. You remember the constructivist theory says that we start with something. The students start with something. They have some fundamental learning and then we construct or build upon that. That is so correct. Approaching the patient if we have no information is not congruent with the constructive theory, which builds on past experiences. The constructive theory builds on what the student already knows or has experienced. Therefore, using material we learned yesterday and applying it today, start with what we know about this situation and then assessing the patient and relating what is similar in this case to other cases we have worked through all relate to past experiences. Great. 3, during a team-based simulation scenario, one student takes the lead and approaches the patient first and takes a blood pressure when the mannequin tells the group that they feel lightheaded. The student who assesses the blood pressure is displaying which learning style? Okay. Kolb's learning theory. Which learning style? A, concrete experience. B, abstract conceptualization. C, reflective observation. D, active experimentation. Yes, what makes this act, what makes this what part of the question gives us the cues or leads us to answer D as active experimentation? What are some of those key things in the question?
It takes the lead and approaches
Uh-huh.
the patient first and takes the blood pressure when the mannequin tells the group that they felt lightheaded. So it kind of initiates and kind of actively, do the blood pressure for the patient.
Yes, in response to what the patient's complaint. Active experimentation. That's right, Artie. You're correct, Laurencia. That's correct. Yes, yes, yes. Active experimentation. Active experimentation. Using hands-on practice to learn the skill. Concrete experiences taking initiative to obtain the blood pressure is not an example. It builds from reality. Builds from reality. Builds from reality. Abstract conceptualization, taking initiative to obtain a blood pressure, is not thinking about what to do. Did it. He did it. He actively did it. Reflective observation, taking the initiative to obtain a blood pressure, is not a reflective activity. They didn't look back on and see behavior, what activities done to determine what needs to be done differently the next time. No, they actively responded to the patient's changing vital signs by taking the blood pressure. Good. Make sure you go over those tenets of Kolb's learning theory. Again, it's not the definition, but it's a scenario, a little small case study. We have to pull out of that the tenets of the theory. And that's on your sheet as well. The simulation healthcare educator has developed a simulation scenario based on the scaffolding learning theory and presents it to a group of students. The students are provided with an explanation of the case that becomes increasingly difficult. The group was unable to formulate a cohesive plan for the patient. One learning element that is most likely missing may have been A, instructor present, B, realism, C, constructive feedback, D, knowledge. Correct. C, constructive feedback. The instructor was there. Realism, constructive feedback, and knowledge. Why was C the best answer? Why was C the best answer? What do we know about constructive feedback? Why is constructive feedback important in simulation education? Why is it an important strategy as an simulation educator to provide constructive feedback? What does it do for your learner?
It's enhance their knowledge, also guide and then constructive feedback in the sense that it's kind of tell them what they didn't do well, kind of guide them towards doing the right thing.
Yes, in the event that you see something that's not right or the behavior that's not correct, you're able to provide that feedback in hopes that when you provide that constructive feedback, yes, already identify area of improvement. Because once you provide that constructive feedback on that area of improvement, what are you expecting to happen the next time that student or when they go out into clinical practice? You're expecting their behavior to be what? Changed. Right? The power of constructive feedback. But when we read this, it says that the students are provided with an explanation of the case that becomes increasingly difficult. It's scaffolding up. The group was unable to formulate a cohesive plan for the patient. They were unable to do that because they never was provided any feedback as they were scaffolding. As you're scaffolding, you should be providing feedback to the students as it continues to move up. If you're seeing the students do something that's the behavior is not correct, you have that moment to time out, but also to provide feedback. So they couldn't make a plan if they didn't know where they were doing it. Not a cohesive plan, right? One of those missing learning. Good. Constructive feedback may be a missing element to the student's inability to what? Complete or construct a plan. The 4 components of Vygotsky scaffolding learning theory are constructive feedback, explanations, reflection, and revision of knowledge. And it really, if you see how he has those tenets, they kind of build on themselves too to make a complete learning experience for your students. Instructor presence is not warranted to construct a plan because, students can come in and do learning and learn really if they have feedback or have something. Now we have AI, that can provide that feedback. They can still learn. The instructor don't have to be right there. Realism is not part of formulating a plan. Knowledge is present, but there is no indication that a revision of knowledge is necessary. Number 5, guided by the social learning theory, the healthcare simulation educator demonstrates to a student who has low self-efficacy how to insert chest tubes correctly. The principle that the healthcare simulation educator is using is A, mastering experience learning, B, vicarious experience learning, C, verbal persuasion, or D, physiological state. Physiologic state. Correct. I would love to hear why B is your answer. It's correct. I would love to hear your explanation. Why did you choose B? Again, we're thinking about, it's talking about the social observation. Good. Through observation, anybody else? Guided by the social or healthcare simulation educator demonstrates watching someone perform the task. Yes. Yes, modeling. Yes, that's right. Yes. All of that together. Living through, observing through someone else, the students are able to do the activity or change or learn. So correct. Vicarious learning. The healthcare simulation educator is using vicarious experience learning because the student is observing the healthcare educator, simulation educators, demonstration of chest tube insertion, and by doing that, the student is now going to be able to go in there and do it effectively as well. That's what we're hoping that should happen. They see it demonstrated. Mastering experience learning is incorrect because the student is not demonstrating it on their own. It's the simulation educator that's doing it, right? So we knew it couldn't be mastering experience. They have no history of success and is inactive during this simulation. Verbal persuasion is incorrect. Why? Because there's no evidence that the healthcare simulation educator is providing any verbal encouragement. The physiologic state is not correct because there's no evidence either that the healthcare simulation or the student expressed success in achieving chest tube insertion. There's no changes. Number 6, one of the healthcare students was previously an emergency room technician. All right, Kara, they're in the ED. And during a simulation pre-briefing, they state that they would like to advance their splinting skills. The student is demonstrating which type of educational concept? Yes, already then applied to future skills. You're correct. Pedagogy, B, realism, C, behaviorism, D, andragogy. Yeah. Why did we say D? You're correct. Tell me why. Adult learning. That is so correct. And what do we know about adult learners? They what?
They have previous knowledge.
Previous knowledge. And they're also always wanting to do what? What do we? Self-direct. And how is this going to benefit me? Because I got to get better. How is this going to benefit me? Because he said, I want to go ahead and advance my splinting technique. That's what they told him already. Hey, I just want to get better. How is this going to benefit me as an adult? Adult learners, we want to know, how is this going to make me, get better, move forward? Right? We're not in right now. It's you all adult learners are all looking forward as well. Self-directed. Great. When you think about andragogy. Yes, is correct, because the student is what? Advancing self by building on past experiences. I could do this, but I want to get it better. I want to do it better. Pedagogy is a method of learning used to teach passively, mostly to younger students without previous knowledge. Realism refers to the fidelity of the simulation and does not apply in this situation. Behaviorism is not correct because there's no evidence that the student is demonstrating learning through a behavior change. Your younger students, what do they want? Give me the shortcut, let me do it now, and I'm good. But your adult learners, they have a different perspective in when we look at our experiences. Good. Number 7, the new healthcare simulation educator needs additional information when they provide a list of NEBO's simulation learning principles as A, occurring in a safe environment, B, tutors being available to learners, C, teacher-centered, D, mimicking real life. Again, this is a theory we may not hear a whole lot about, but it's looking at the principles and the concepts and how it relates into simulation education. Yes, C is our answer. Teacher-centered. Apply the learning to a patient with care with positive outcomes is the, Number 7, NEBO simulation principles include a student-centered, not teacher-centered principle. Additional principles include simulations occurring in a safe environment, having tutors available for the students, and ensuring the simulation mimics real life. Number 8, Kirkpatrick. We need to know him. We hear him often in education, period. Simulation learning principles are orderly, and once learning is achieved, the healthcare simulation educator should expect the student to A, react to the debriefing questions, B, apply the learning to patient care with positive outcomes, C, learn through a pre-module requirement, D, demonstrate a change in behavior. Correct. Yes, you know the levels. Level 1, 2, 3, 4, 5. Levels 1, 2, 3, 4. I'm sorry. I added another level. But correct. It's apply the learning to patient care with positive outcomes. Because they've already learned, now we want them to go take that to the hospital, take that out, and actually do what they've learned in simulation, right? And we're expecting patient outcomes to be positive. Level 4 is an area that we still need some more research, and oftentimes is the level we don't get to see a whole lot of as educators, right? Because once it starts changing and patient outcomes, they need to be doing some things in the system that's also gonna. Hold on just a second. My computer is wanting to go low on me, so let me see if I can hurry up and get through this next section. I don't want it to cut off just in case I have to put us back in. So yes, it is B. B is our answer. Applying learning to the patient with positive outcomes. Apply the learning to patient out care with positive outcomes is the highest level, level 4 in Kirkpatrick's pyramid. Reacting to the debriefing questions is an example of what? Level 2. Level 2. Learning through a pre-module requirement is also level 2. And demonstrating a change in the behavior is actually level 3. Okay. All right, we go from reaction. What do you think? How do you feel after doing the simulation? Oh, it went well. To learning, tell us what your takeaway is. What did you learn? Do you understand the concepts? The B, behavior, the next level, you see a change in the student's behavior once they go into healthcare. They're actually doing what they've learned in simulation. And then D, level 4 would be results that are following those changes in behavior. Number 9, the last step of Dora Mori's simulation teaching learning process is A, debriefing, B, transference, C, developing learning outcomes, D, creating the situation. Yes, the answer is B. It is B. Transference is the last step in Doors and Murray's simulation teaching learning process, taking the knowledge learned in simulation and applying it to the actual patient. Developing learning outcomes is the first step, creating a situation is the second step, and debriefing is the third. Number 10, a simulation educator is developing student objective learning outcomes and would like to assess students at the application level. Which objective learning outcome would best fit the application level? Bloom's taxonomy. A, defining the hybrid simulation procedure. B, discussing the clinical decision for starting CPR. C, prioritizing the intervention. And D, evaluating the intervention's effect. We are in Bloom's. You know, make sure we exactly identify that in sim practice. C is your correct. Prioritizing interventions takes us to the application level. Prioritizing the intervention is the application level objective at Bloom's taxonomy. Make sure we can see that you did very well in any type of scenario. Defining the hybrid simulation procedure would be recall. Discussing the clinical decision for start CPR would be the object at the understanding level, lower level. Evaluating the intervention's effect would be an objective at the evaluating level, which is higher than application. Okay, y'all did very well. We had 100. I saw it. So we're going to take our first break. I'm proud of you. The theories is in your folder. Now, if I got to find my cord. So we're going to take a 15-minute break. I have 7% left. I'm going to find my cord and put it in. If you come back in and have to log in, just go ahead and log back in. But I hope to get it plugged up before it goes off. I'll see you back in 15 minutes.
Thank you.
Mm-hmm. Okay. We are back. All right. I see you already. That is so cute. So we are chapter 15. We've just went over educational theories. Again, I want to encourage you. Read over your theories. Check out the resource that I have in your folder. Make sure we're not memorizing theories, but seeing what those theories look like when you play them out as they are, as we role model those theories out as simulation educators with our students and create scenarios and looking at our learners, et cetera, et cetera. Make sure you tap back into your NASCO standards of best practice as well. And we do have some information over in the defining excellence in simulation programs, some cross-referencing over there in chapter 7.3, pages 663 to 673 talks a little bit more about your theories in pedagogy. Okay, so we're going to start chapter 15, implement simulation in the curriculum. Okay, implementing simulation in the curriculum. Question 1, the novice simulation educator needs more understanding about integrating simulation throughout the curriculum when they state A, resources are needed for personnel and equipment. B, a new building may be needed to accommodate the program. C, high fidelity equipment should be purchased. And D, faculty buy-in is not necessary. It doesn't affect them. Correct. 100% D. Faculty buy-in is critical, right? Especially if we're looking at integrating simulation throughout the curriculum, right? We need faculty buy-in. Administrative buy-in is at the high end, but if we can get faculty buy-in, that builds our case, because then now you have simulation educators and faculty. We all can go up as a nice unit up the chain, but that's correct. B is your correct answer. Faculty buy-in is always needed and makes necessary and makes successful simulation programs. Resources are needed in both areas, personnel and equipment. A new building may be needed if the space resources are scarce. High fidelity equipment would be needed for a complete simulation laboratory experience. Okay. High fidelity equipment should be purchased. Well, we learned last week, we went through task trainers, so our best answer is faculty. They need a little bit more understanding about integrating simulation throughout the program, because you can integrate without having all high fidelity simulators or high fidelity equipment. Number 2, the first step in integrating simulation through a curriculum should be A, acquire equipment. B, develop student learning outcomes. C, review the mission and values. Or D, perform a needs assessment. There we go. Part of our NASCO standards of best practice. The first thing we should do in that planning phase is what? Do that needs assessment. You are correct. You are correct. Second would be the mission and values. Third, develop those learning outcomes. And then the last would be to acquire the equipment. Good, good, good. Integrating simulation according to the learning outcomes. Make sure equipment is choice correct. No need for high fidelities. Yes, yes, yes. Performing a needs assessment is always the first step to evaluate if a simulation program is needed. What do they need in this program? Do we have to have a simulation program? You're going to look at who all is in your program, who's all in your school. Is it just nurses? Do we have physical therapists? Do we have nurse practitioners? Do we have dietetics, et cetera, et cetera? The next step would be to review the mission, and then the student learning outcomes and equipment can be purchased later. Number 3, the novice simulation educator needs better understanding when they state that simulation competencies should include which of the following domains? Psychomotor, A, B, cognitive, C, empathetic, D, affective. That's correct. What are the three learning domains?
Psychomotive, affective, and the cognitive.
Exactly. Yep. And we all understand what each one of those look like if played out in a scenario. We know what domain they're looking for if it was put in a scenario. Your skills, Foley insertion, hands-on, psychomotor. Your affective, emotional, really trying to get to the emotional side of the student, the affective response to a scenario. And then when you look at your cognitive, what do they understand? The concepts? Are they connecting the dots? What domain? And that's what we, yes. Develop our simulation scenarios. What domain are you assessing? Empathetic is a needed attribute in healthcare, but it is not a learning domain. Psychomotor, cognitive, and affective are the traditional learning domains. Empathy falls within the affective learning domain. The final step of developing an integrated simulation curriculum is a systematic program evaluation. B, deciding on teaching methods. C, developing student learning outcomes. Or D, discussing the mission. Correct. The final step in that whole development would be systematic program evaluation. The systematic program evaluation should be ongoing in order to make program improvements in real time. Yes. Teaching methods, student learning outcomes, and discussing the fit of the missions are all part of the program development and all should be systematically evaluated. Number 5, the simulation educator understands deliberate practice. We heard that already tonight. When they state A, it has an outcome of developing perfect skills. B, it is a method to evaluate and grade students. C, it is a method to ensure appropriate formative evaluation. D, it is a method to use to become competent in skills. D is correct. It's a method to use to become competent in skills. Deliberate practice, we talked about that a few sessions ago, where they go through repeat it. A nice way to help move that student towards safe practices. It's a teaching method to assist learners in becoming competent in a skill. Deliberate practice is not used for formative or summative evaluation, and the intent is not perfection. The intent is what? Competence. A student is practicing insertion of a central line in a hybrid simulation with a standardized patient. It is learning mainly in which domain? A, affective and psychomotor. B, psychomotor and psychosocial. C, cognitive and affective. Or D, psychosocial and cognitive. Why? Wonderful. That is correct. Why is A correct? Why is A? Why did we choose A, affective and psychomotor? What inside of that question led you to choose A, affective and psychomotor?
It's a psychomotive. And then the use of the standardized patients, during communication, reaction, body language, as the instruction addresses the affective end of it.
That's so correct. You're right, Artie. The insertion of the central line is the psychomotor part, right, Laurencia? And also, when you look at the standardized patient, remember, standardized patients is our highest form, right, of fidelity, right? And they're going to give us that emotional, that affective part that we would need to test in that scenario. Correct. A standardized patient responds to the human-to-human interaction, affective needed in the affective domain. while a hybrid mannequin or a part task trainer is used to what? Promote skill development, which is mainly in the psychomotor domain. Cognitive domains address the why. Something is being done, why psychosocial is not a labored domain. Awesome, awesome, awesome. Number 7, a scenario in which a student is telling a family member bad news about a patient developing skills in which domain? A, affective. Yep, correct. A. You are correct. Because again, we're looking at bad news evokes emotions, right? So we're wanting to see how that student's going to respond in a therapeutic way with therapeutic communication or therapeutic touch. So we're looking at the affective domain. You're correct. Psychomotor, we're not doing a skill. Cognitive, we're not trying to pull together the stages of grief and to make sure they understand that. Psychosocial is not a domain. Cognitive, affective domain development is needed to discuss critical information with patients and families. Cognitive is important for knowing the why. Psychomotor is not usually a major factor. Psychosocial is not a domain. Number 8, a student who is calculating the correct morphine dosage in a simulation to complete a patient control analgesic PCA pump setup is developing skills in which domain? Affective, psychomotor, cognitive, or psychosocial? C, again, what in that sentence makes this cognitive? What in this calculating? That's exactly right. Calculating. Thank you, Artie. That's exactly right. Calculating a dosage. That's what makes this cognitive. Great, great, great. Cognitive or cognition is needed to understand correct calculations and correct dosage. Psychomotor comes into play when setting up the pump. And affective is how the treatment is described to the patient and family. Psychosocial is not a domain. You can see this played out in scenario. They may say, hey, what would you do if you had the da-da-da-da-da? You're wanting to test this domain. What type of activities would you choose? If you had to choose the activities, you make sure you understand which domain. If it's psychomotor, it'd be more skill related. If it's affective, emotion, right? Feeling. And if it is cognitive, it's more the learn to know how. And that way you'll be able to choose the appropriate activity. If you have to have a case scenario on your CHSE exam, and you have to choose the appropriate activity to line up with the domain. 9, a fundamental simulation principle for educators to consider is A, student learning outcomes should match the simulation being designed. B, always use the lowest simulation type to accomplish an educational task. C, the more real the environment, the better the learning outcome would be. D, all students should be exposed to all simulation types for best practice. Correct. It's a given. Learning outcomes must match the simulation design. When I saw that, all the rest of them was irrelevant. It didn't really matter, right? Because the fundamental simulation principle, as we start out with our NASCA best practice standards in planning, is making sure that our outcomes match the simulation. We have our outcomes, we design the sim based on our learning outcomes of the student. All those other ones, Student learning outcomes should drive the simulation methodology. Although using the lowest simulation type is good to conserve resources, it may not impact learning. Realism does not always ensure that objective student learning outcomes are met, right? We talked about moulage. You can put too much and it will cause the students to not even meet their learning outcomes. Making sure all students are exposed to all simulation types is not necessary for learning. Okay, number 10, the novice simulation educator needs a better understanding when they include which of the following attributes when describing simulation feasibility: efficient, effective, available, and achievable. Right. We're thinking about feasibility related to transference of skills to clinical practice. Is it feasible to do it? Do we have those things that are available? Available is not one of the attributes of feasibility. Feasibility has to do with what? Transferability of skills to the clinical environment. Can these skills be transferred? The skills are needed to be effective and efficient, and the competency or the skills should be what? Achievable. Hands down. Okay. Good. Any questions regarding that chapter? Again, these is 40% of our exam. We're doing really well with the questions we have tonight. I encourage you to go into the Pallegana's book and take a deeper dive, make sure we're understanding our theories. Now we're making sure when we talk about this last chapter 15, the one we just finished, your NASCO best practice standards, those articles that I have in your folder week 1, you want to be able to read those articles, highlight, and be able to teach all of that to someone else and put it in a scenario, put it in a way that's implemented and seen in the simulation. That's where you're going to see your best practice. 40% of our HSE tables right back to those best practices. Number 6, chapter 16, page 271. Y'all, we're looking pretty good. Y'all ready? We're going to go ahead and go. Number 1, y'all ready? A novice educator is developing goals and objectives, outcomes for a planned simulation. Identify which statement is an example of a well-written objective. Still in our NASCO standards, best practice. A, at the completion of the simulation, learners will understand the importance of good technique. B, following the simulation, learners will identify important concepts related to IV therapy. C, upon completion of the simulation, learners will appreciate the skill required to insert IV catheters. Or D, after the simulation, learners will demonstrate the correct steps for IV insertion. Correct. Our answer is D. Now tell me, I want to know why did we choose D? What made D the correct answer? When we're thinking about objectives and developing learning objectives, what do we know about those objectives? Why did we choose D? Clear. Yes, clear and specific, measurable, smart, right? Specific, smart. S for specific, M for what? Measurable. A for attainable or achievable. R for what? Being realistic. And T, they are timely, timeable, time. We have a timestamp for it. And when you look at D, it has all of those components, right? Especially in comparison to the other ones, they really don't have all of those components we just talked about, the characteristics of a SMART objective. The rationale in our book says this objective precisely states a concrete short-term behavior that the learner is expected to accomplish when following the simulation. You're right, Laurencia, demonstrate. Good, good. The verb that is used is specific with little room for variance in interpretation. This objective is also written using ABCD rule, which includes the audience, behavior, condition, and degree. The objective is what? Measurable. Understanding is difficult to measure, identifies a low-level verb on the Bloom's taxonomy, and appreciate is also difficult to measure. 2, a simulation educator is planning to use formative evaluation during a simulation exercise. Which statement indicates that additional knowledge of the types of evaluation is needed? I plan to use a form to provide learners with feedback about their performance. B, I will develop a rubric for faculty using grading the learners' performance. C, I will meet with learners individually, discuss any areas needed for improvement. I want to provide adequate time and opportunity for the learners to self-reflect. The correct answer is B. B. And why is the correct answer B? Someone tell me why B. What makes B the correct answer when we're thinking about formative? Yes, exactly, Artie. Grading is not a formative assessment. We're more summative. You remember formative, we're forming their learning, we're providing them feedback and allowing them to continue to correct their mistakes along their way to perfection. Okay, good. B is the correct answer. During formative evaluations, simulation educators provide feedback in order to facilitate learning and identify areas that need further reinforcement or improvement. Although formative evaluation can be graded, this is more often associated with summative evaluation. A form can be used. Learners should be provided time to reflect, and students should be what? Provided individual feedback for formative evaluations. Number 3, a course coordinator is discussing debriefing with the clinical faculty adjunct. Which statement demonstrates that the educator has a clear understanding of debriefing? A, debriefing is a great method to use when teaching students using task trainers. B, incorporating debriefing is the best way for students to acquire short-term learning. C, during the debriefing process, students have the opportunity to assess their performance. And D, debriefing can be used as a graded evaluation of student learning. Correct. The answer is C. The answer is C. The answer is C. Tell me, when we're talking about debriefing, C is the correct answer. It's more of a reflective. Debriefing is a great method to use when teaching students using task trainers. Incorporating debriefing is the best way for students to acquire short-term learning. Remember, debriefing is a reflective time of our, at the end of our simulation experience, where students are able to what? Reflect back on their behavior, reflect back on that scenario, as Socratic questioning, so that we can cause those students to connect the dots, right? And really, that's where the learning comes alive, in that reflective time in our debriefing processes. During the debriefing, students have the opportunity to process what they've learned and to use feedback provided by the faculty and peers to reinforce their learning and identify areas for improvement and growth. Debriefing should be used for all simulation modalities used for learning and should add to the students' long-term memory. Debriefing is not a grading process. Number 4, feedback is an important part of the evaluative process. Identify which one statement is most important in providing learners with effective, useful feedback. A, standards or criteria should be developed so that the faculty are consistent in their grading. B, feedback should only be provided by the course or simulation coordinator. C, only positive feedback should be shared if the observer misses part of the simulation. Or D, an observer can provide feedback even if they lack knowledge of good performance. Correct. A. A is our correct answer. Standards or criteria should be developed so that the faculty are what? Consistent in their grading. Consistent in their grading. Everybody's saying the same thing. Consistent in their grading. Reliable, valid tools. Reliable, valid tools. Been tested, tried, and true. Feedback is consistent across the board, right? It is important that the person observing and providing feedback has expertise in the content and the knowledge. Meaning, we're not going to put somebody in there that don't even know anything about what they're providing feedback about. You won't go and pull somebody else to say, you won't go and pull somebody else in to try to help them come and fill in whenever. Hold on just a second. Okay? You will not do that because that's not best practices. Okay? All right. So our answer is A, standards or criteria should be developed so that the faculty are consistent in their grading. It is important that the person observing and providing feedback has expertise in the content and the knowledge of what constitutes good performance. Standards or criterion help ensure that all observers are consistent with their feedback. Rubrics are often helpful in this regard. Feedback can be given by others, such as simulated participants, and feedback does not always have to be positive. Observers need to understand what competency standard is what being expected or assessed. That's very critical because you just can't pull anybody in to do those assessments, right? Okay. When we look at my book hit the recording and it paused it. Sorry about that. We had a slip of our book. Now we have it back in the recording. A simulation educator is planning to use an objective, structured clinical examination. And that's better known as what? OSCEs, right? To evaluate learners at the conclusion of their Adult 2 course. Which statement is most accurate description of an OSCE? Okay. All right. You are correct. B. An OSCE is a valid assessment tool for evaluating competencies and judgments. A valid, we see that a lot in our practitioner programs, right? And when you have an OSCE going on, whoever is the evaluators, they need to be trained and they need to understand that tool because that tool, again, is a standardized tool. OSCEs have been used for years as an evaluation tool in medical education, but they've also been found valid in evaluation of skills and competencies of other health professionals. In choosing a tool for evaluation, it is important to consider what? The validity and the reliability of the assessment. Valid and reliable. OSCEs can be used in many healthcare disciplines. Self-assessment is different types of evaluation, and a newly created checklist would need to be what? Tested. Your keywords is valid and reliable, and the evaluator has to be trained. Number 6, a first-year faculty member is going to incorporate simulation into their adult health course for the first time. Which statement indicates that they have a clear understanding of the planning and organization of the simulation experience? A, the simulation should last as long as the learners would have been in the clinical setting. B, to minimize faculty time involvement, each simulation can include up to 12 learners. C, learners will have the opportunity for hands-on practice with skills during the simulation. D, a scenario including a pediatric patient with asthma would be a great learning opportunity. Tell me why C is the best choice. Out of your A, B, and D, what makes C stand out? When we think about our question. A says the simulation should last as long as the learners would have been in the clinical setting. A and B are wrong. Correct. First year faculty member is going to incorporate SIM. Which statement indicates? Oh, So let's go and see what it says. Students are able to practice skills, competencies, and interact with the faculty to achieve the learning outcomes of the simulation and course. Simulation learning is not necessary the same time commitment. You know, we have different ratios, 2-to-1, 1-to-1, 3-to-1. Clinical hours to sim time. Simulation learning is not necessary the same time commitment as direct clinical experiences because it is more intense. The number of learners depend on the scenario and the course objectives can fluctuate. It is an adult health course, so pediatric experience would not fulfill the student learning. There again, making sure that scenario is congruent with the learning outcomes, right? It's an adult 2 course. You wouldn't definitely bring a pediatric scenario into that simulation lab for the student because it does not match our learning outcomes. Number 7, the simulation coordinator and the course faculty for the psychiatric mental health course are discussing the best way for learners to practice communication skills. Which modality would best assist learners in attaining this skill? Tell me, you know, I'm going to ask this question. Why would A be your best answer? Why is A the best choice? Exactly, SP, your standardized patient. Yes, yes, yes. Communication skills, that human patient, standardized patient can talk to you. That's what makes that the best modality. Yes, yes, yes. Standardized patient or SPs are effective in practice and acquisition of non-technical skills such as communication, therapeutic use of self, and patient advocacy. High fidelity mannequins or mixed or hybrid simulations and low fidelity part task trainers do not afford the interpersonal communication needed. Number 8, a simulation educator is planning to use high fidelity simulation for learners to utilize clinical judgment in a scenario in which the patient is rapidly deteriorating. Identify the one action that will best ensure that the simulation runs smoothly and effectively. A, list the equipment that will be needed for the sim. B, identify additional content experts that can be used for future sims. C, book simulation space at least 6 months in advance. Or D, schedule a trial run with key personnel in advance of the simulation. That is right. There we go again, going right back to our NASCO standards. I'm telling you, this 40%, you need to know those are NASCO standards. Those articles, make sure you understand them, because here we are again, breaking out what we call a pilot study, a pilot sim. How you use exactly, Artie. You need to pilot your sims. Best practice. Again, don't answer how you're doing in your sim center, because a lot of us have a hard time trying to. If you're a one-man person, you may not have all the time to do pilot sims. A lot of time, your first sim in action is your pilot, but you're actually doing it with the students. So best practice say you should pilot all of your new sims, right? So that you can see and troubleshoot. And if there's anything that should go wrong, you can get that right before you actually run that live with your participants. Going right back to those NASCO standards, 40% of your tests. Okay, good. We saw that rolled out here. Do that pilot run, that pilot test. Scheduling a trial run or a pilot test is most important so that any barriers can be corrected before it is a learning situation. A trial run or pilot is necessary to ensure that key personnel have a shared understanding of the simulation while providing an opportunity to identify any potential problems. Planning in advance, including resources, location, equipment, and availability of content expert is important to ensure the success of any simulation. Number 9 says a team of faculty are planning a large simulation involving multiple SPs, multiple standardized patients. Which statement indicates that the faculty need further guidance in their plans? A, we need to consider budget funds available for paying professional actors. B, we could work with faculty from theater to involve their students as standardized patients. C, if our standardized patients don't show up, we can use any students or faculty available. Or D, alumni could be asked to volunteer as standardized patients. Yes, correct, correct. And Artie, you knew I was getting ready to ask why. You are correct. SPs need to be trained and not just an available person. When you have an SP program, or when we have SPs that are embedded into our simulation experiences, they must be trained. We can't go back to how we may be using them in our program, because you may be pulling a faculty member here and there. But best practice says what? They have to be trained, scripted, interviewed. You just don't pull one in and have them. And remember, we talked about SPs. You limit their contact with students or the participants prior to the simulation to minimize tainting or disrupting their fidelity in the simulation. So they need further guidance by saying they just pull anybody in. Standardized patients are oriented to the sim scenario. Putting others in the role may not yield the same results and may not be effective. Paying professional actors to perform as standardized patients can be costly. So other alternatives such as alumni, drama students, and other healthcare students should be considered. And that's true, long as we train them. Long as we train them. Minimize their contact with the students prior to the simulation. Making sure, good, guess what? SPs are not doing what? Evaluating either. I mean, we talked about SPs need to have a tool that they can actually have a standardized tool they can check to provide feedback, but the simulation educator is the one that does the evaluation at the end of that scenario, doing that simulation. Your SPs are going to do what? Provide feedback, but they're not the evaluators, but they have to have that tool and they need to know how to use that tool. Just recapping some of the things we've talked about when we think about SPs. 10, while discussing pre-briefing with their mentor, which statement by the new faculty member indicates that further information is needed? A, during pre-briefing, I plan to review information relevant to the simulation scenario. B, learners will have the opportunity to familiarize themselves with the laboratory during pre-briefing. C, I will orient the learners to the capabilities of the mannequin during the pre-briefing. And D, the learners will be able to complete all their prep work during pre-briefing. Correct. So tell me, what is pre-briefing meant for? And that'll tell me why you chose that one. D, pre-briefing. Again, we're going back to the NASCL standards. Really harping a lot tonight on standard 1 when we're thinking about pre-briefing. We're planning and pre-briefing, all of those in that same standard. It's really talking about that a lot. 40% of our exam, educational principles applied to simulation, are NASCL best standards. So what do we know about the pre-briefing phase? What happens in pre-briefing? They're able to complete all their pre-work. Pre-briefing is a time in our simulation when we're going to make sure we do what? What are some of the components of pre-briefing? You can put it in the chat or you can say, what are some of the components of pre-briefing when we think about best standards? What are some of the things should be achieved in your pre-briefing? Orientation to the simulation, yes. Yes, that's right. Establishing a psychological safe learning environment. Yes, preparation materials should be completed before the sim. And in that yes, pre-brief, not pre-work. I love it. You making sure in that pre-briefing, what else you want to make sure? Fiction contract. Make sure we're going over that fiction contract. Establishing a what? Safe psychological environment. Making sure we talk about how we are able to dismiss. Yep, talk about the logistics. How is the simulation going to run? You want to dismiss disbelief, right? And really make sure you're able to do that in that pre-briefing. You want to talk about scheduling. You want to talk about the schedule of the sim. What are we going to do in the time frames? You also want to talk about what? Their roles. You want to assign the roles and make sure everybody understand their roles. Anything that's going to be real or not real, we want to make sure we establish that inside of that pre-briefing time. Any equipment that the students are not familiar with, you want to make sure in that pre-briefing you have time spent to get those students ready. You want to, by the time you finish your pre-briefing, you should have a good feeling, a good indication that those students are ready to go into that simulated experience. Awesome. Pre-briefing. Go over the ground rules. Yes. What happens in simulation? What stays in simulation? Making sure we respect each other. We talk about what debriefing is going to be about. We talk about pre-briefing, the experience, and debriefing so that the students, the learners are not, they at least have an understanding on every component that is inside of that simulation. We take them to the sim room. We let them explore the equipment. We let them walk around. If they haven't used that simulator before, and this is their first time using a human patient simulator, you need to give them time to put that stethoscope on the chest. Listen to that simulator so that they can understand that's the heart or that's the computer. Let them touch the mannequin. Let them touch the equipment. Let them explore that room before confidentiality, correct. What happens in simulation stays in simulation. All of that is in our pre-briefing time. And I love what you're saying. It's pre-brief, not pre-work. Should be done prior to coming into your simulation environment. Okay, preparatory work should occur before students arrive for sim. Exercise pre-briefing is a time to orient the students to the simulation environment and equipment, discuss information relevant to the scenario, and answer any questions. Awesome. We have made it through our next 2 chapters. We're going to take our last 15-minute break. It is now 7:47. This chapter is difficult. The one we just finished or the one that's coming up, Artie? Which one you talking about? The one we just finished, chapter 15? I mean, yeah. You talking about chapter 16 or the one we're getting ready to go into? Which one is chapter 16? Yes. Okay. Yep. Well, this is what we just went over. I'm telling you, if you go back to your NASCL standards, those articles and read, I mean, I highlighted, I scratched up, all kind of things. If you can go through those NASCL best standards of best practice, that's where you're going to get the most for this section here, especially when we're talking about chapter 16. Not for memorization, but what does it look like when we see it implemented in simulation? In practice, how do we use the best practice standards to create scenarios, to evaluate our students in the area of simulation? Okay. All right. They do have a few articles. Those they have some information in your Pallegana's book as well, Defining Excellence in Simulation. There's some additional reading in there on the NASCL standards, but those articles are really good. If you can get a handle on those articles, you should be you should be good. Okay. All right. It's 7:49. We'll take a 15-minute break and we'll come back and we'll finish up our last chapter tonight. Everybody good? Thumbs up or thumbs down? We good? Awesome. Okay, we're gonna start back. We always know this last few minutes typically goes pretty quick, so we want to go ahead and get started so I can at least share some knowledge about debriefing. That's our final section of tonight. Everybody okay?
Yeah.
Awesome, awesome, awesome. Wonderful, wonderful. One of my favorite debriefing, talking about debriefing. There are several debriefing techniques. Just want to make sure we highlight those techniques and then we'll get right into our questioning. And we'll go through our 10 questions on debriefing, but debriefing, you want to make sure that it is structured. You want your debriefer to be trained in debriefing. You don't want just anyone to go in and debrief. There's several debriefing tools and models out there, and the way that we even should have our students organized in the setting around a table when we're doing a debriefing with the educator, um, either in the middle or at the front. You can do different types of structures for your debriefing setup. You want to debrief away from the simulated room if possible. Inside two sims are a little different. You want to have it in a quiet space that you keep that area psychologically safe. It is a time of reflective learning where the students are the center and we are the facilitators. That's why you want someone that is trained in debriefing techniques to do your simulations. The timing and the location is important. Your goal, your debriefing is learning objective driven, just making sure that the learning objectives for that simulation has been achieved. Safe environment, the role of us as the debriefer, we're to guide that discussion and get at Socratic questioning, asking those students to question, helping them link the dots together. You have the 3D, model. That is one of the models that you have out there. Looking at diffusing, discovering, and deepening, where we reflect on the experiences, identify mental models that lead to behavior or cognitive processes. That's your 3D model. You also have a plus delta, which is one of your models where if you're new to simulation, plus delta is one of the easiest ones. If you had to choose to which debriefing method you would give to a novice simulation educator, the plus delta would be your choice because you're asking what went well and what would you change. 2 columns, what went well, what would you change? Very easy simulation method to do, technique to do advocacy inquiry. It's sometimes and often referred to as debriefing with good judgment as well. We do non-judgmental approaches to a debriefing. We are the advocate for the patient. I noticed that when you got ready to give that IM injection, you paused. Can you please tell me what you were thinking? Or I noticed that you went ahead and proceeded with giving your medications. I was concerned. I did not hear the 5 rights. Can you tell me what was going on? So we act as the advocate, but we're still putting it back on the student to bring out their rationales and helping them connect the dots. Advocate inquiry. Advocacy, providing the feedback to the learner, describing the mismatch between the performance and the objectives or the standards. The inquiry part is the general curiosity. Tell me what you were thinking. Tell me what you were thinking. And that's how we get into the frame of the student and able to actually really pull that learning out. When we think about debriefing with good judgment, we're looking at reaction phase, understanding phase, and the summary phase. Also, we also have our other methods are pearls. Pearls is another method of debriefing. Pearl stands for promoting excellence and reflective learning in simulation. It's a blended approach where you're looking at a learning assessment, facilitating focused discussion, as well as providing feedback to the students in a very directive way. 4 phases of pearls, we're looking at reaction, description, analysis, and summary. Okay. So those are different types of ones that we kind of highlight, those ones that we often hear information about. I just challenge you to go back and really touch in and look and see how they are overlaying into simulation experiences and how we use them as simulation educators. If you need additional information, just make sure you reach out to me. There is some additional reading in the book as well, but that was just a quick synopsis of our debriefing methods and techniques. We're on page 289. Number 1, the novice simulation educator needs further instructions when they are facilitating a debriefing by A, observing the entire simulation, B, taking notes on observations during the simulation, C, using the experienced debriefer as a consult, D, starting debriefing student 1 at a time. Correct. It is correct. Start it debriefing is not what you want to do it collectively all at one time unless we're doing a simulation one-on-one with a student, right? In a group, that would not be the right thing to do. Debriefing should be completed in a group format and not one student at a time. Simulus should watch the entire scenario, take notes, or use a consult if needed. You don't want someone that was not in the simulation, that did not witness the simulation experience. You do not want them doing your debriefing. They need to have at least sit through that scenario and have knowledge of the scenario and how it should roll out, and have knowledge of the content as well. Hence, your simulation debriefer should be trained, not someone you just pull to come and do the debriefing session. And it is not a time to teach or have class. It is a reflective learning time where students are able to reflect on their behavior. And we ask them the questions and learning comes alive. 2, a simulation educator is very new to the debriefing process. Which method of debriefing might be easier for the educator to start with? A, debriefing with good judgment. B, case study debriefing. C, debriefing for meaningful learning. Or D, advocacy inquiry. Exactly. Out of the choices, case studying would be the easiest because we do case studies a lot in our classrooms. So a new simulation educator, when you look at all those choices, the other ones you need some training, right? We need some training. Case studying would be your easiest for that new simulation educator. Case study debriefing may be less intimidating because healthcare educators are using case studies in didactic and clinical rotations or education. Debriefing with good judgment, debriefing for meaningful learning and advocacy inquiry are techniques that are very effective but take professional development and practice. Number 3, ideally the debriefing time should be 5 to 20 minutes long. B, half the time needed to complete the simulation. C, equal to time needed to complete the sim. D, double the time needed to complete the simulation. Oh, that's pretty much a standard. We've heard it for some time. At least double your sim time, 30-minute sim, hour debriefing. However, now there are some practice, there is discussion and has been, and there, the NASCO standards are live standards, they're under revisions and they're doing a lot and looking back at those and adding more evidence base to them. But for the sake of where we are, double the time. That's your choice. You want to select that one. But the end road is, if you don't see that, your end road is that debriefing ends when what? We can really conclude that the objectives have been met for that simulation because your debriefing is learning outcome driven. Okay. All right. Debriefing is where much of the learning takes place and should not be rushed. It usually takes approximately double the time of the sim scenario. Trying to debrief in a short amount of time may not allow learners to reflect and synthesize what happened and what could be learned from the situation. Number 4, the debriefing method in which the simulation educator facilitates the identification for what went well compared to what they should change for the next time is what? A, debriefing with good judgment. C, case study debriefing, debriefing for meaningful learning, or D, plus delta. Correct, plus delta. That's yep. And that's the one you would give to a novice educator as well. It's the technique that starts with the things that went well and then moves to the process improvement. Case study debriefing depicts aspects of a case in chronological order. Debriefing for meaningful learning, and debriefing for good judgment are more issue focused on reflective discussions. I noticed that you did. Tell me more. Number 5, the debriefing method in which simulation educators focus on diffusing, discovering, and deepening is called A, plus delta. B, debriefing with good judgment. C, 3D model of debriefing. D, debriefing for meaningful learning. The 3Ds. Yep. 3Ds. I love in that book, it actually goes in depth and talk about the 3Ds and give you some examples. That's really good. Again, we don't want to memorize the definition, but how does that look when it's rolled out? When we start seeing case scenarios of the 3Ds, what does that look like when we're actually debriefing using the 3D method? 5 says 3D method of debriefing uses techniques of diffusing, any immediate issues, learners discovering a learning opportunity, and debriefing, coaching learners to understand the meaning of the issue on a deeper level. The other techniques do not provide these elements. Plus Delta debriefing approaches learning from starting with what was done correctly, then moving to process improvement. Debriefing with good judgment shares critical information without producing defensiveness, and debriefing for meaningful learning focuses on clinical judgment by reflecting on the student's care and the patient's response. Number 6, the simulation educator wants to learn how to be an effective debriefer. The best method to use to learn debriefing is to read a book with debriefing, practice with experienced debriefer, C, watch a video of debriefing, or D, attend a lecture on debriefing. Correct. And everyone, that was the best answer. It really stood out. That would be the best way, is to have some observations with a seasoned debriefer. All those other things can be helpful, but the best one is to be able to see it role model before them. Practice with an experienced debriefer is very valuable and provides hands-on experience and valuable feedback. Not only are they able to see it, but you're able to provide that feedback and start gently releasing some of the debriefing off to them as well. Practicing with an expert may be more effective than a video, book, or lecture. 7, a novice simulist needs further understanding when they state that the best way to choose a debriefing method is to review all available methods of debriefing. B, compare debriefing method with your personal educational philosophy. C, test out each type of debriefing method. Or D, choose a method that works when time is limited. Yeah, that's correct. That's not what you want to do. That's not what you want to do. You want to choose one to your comfortability as well. What are you comfortable with? What do you understand? Which debriefing method do you clearly understand and you feel comfortable with? So choosing a method that works when time is limited, that is not. We need to help that novice, help them get a little bit more understanding of the debriefing purpose. Debriefing time should not be rushed or limited. Reviewing methods, understanding one's own philosophy, and testing techniques are all important steps to finding a comfortable and effective debriefing model and method. 8, which debriefing method includes a technique called advocacy inquiry? Plus Delta, debriefing with good judgment. 3D, model of debriefing, or debriefing for meaningful learning. Correct. Hence, that's why you may hear it called advocacy inquiry. Exactly right. You're the advocate for the patient. I noticed that I saw this. Can you tell me what you were thinking? You are correct. B, debriefing with good judgment. Debriefing with good judgment contains the advocacy inquiry technique. Plus Delta 3D of debriefing and debriefing for meaningful learning do not contain the advocacy inquiry technique. You saw that statement written in a question where they actually made the statement, I saw, this is, I'm concerned, and you have to choose. You'll be able to pick out debriefing with good judgment, or if advocate inquiry is there, you can choose that one as well. 9, the simulation-based educators beginning the debriefing in the opening statement is, I want to encourage you to share your thinking. This is a time to puzzle through your decisions and actions together. This is an example of which of the following positive educator behaviors. A, orienting learners and building trust. B, establishing learner and educator roles. C, placing the responsibility of learner on the learners. D, placing the responsibility of learning on the simulation educator. Correct. We are fostering what? Building psychological safe environment where they can trust us to learn and also trust us that they can make a mistake and it won't be punitive. Correct. Building that trust. And that is done in the initial pre-briefing start of your simulation. That happens in pre-briefing. orienting learners, and building trust. That's the correct answer. The simulation-based educator is using an opening statement that orients the learners to how this discussion will be focused and their role to share their thinking. You do that you set the stage in pre-briefing, and then when you get ready to start your debriefing session, you roll back around it and bring it to the student's attention again. The discussion will be focused and their role to share their thinking, feel safe to share their thinking. Even if it's wrong, they still should feel safe to share their thinking. So it builds trust by laying out the objective. It does not establish educator roles. It does not place the responsibility of learning on the learner or the educator. Learning is a what? Shared responsibility in our debriefing room. It's a shared responsibility and it is learner focused, learner driven. We're facilitators of the learning. Hence why we really need trained people in debriefing. Because if you just pull faculty to do your debriefing and they haven't been trained, before you know it, you're going to have a whole classroom, whole teaching, and students will be tore apart. Psychological safety going to go out the room because they're going to stand in that debriefing and tell them, you should have known that. You know, I taught you that the other day. And then you've already just messed up psychological safety in your debriefing. So make sure your debriefers are trained and understand protecting that psychological safety and debriefing according to the debriefing technique. Our final question for tonight, number 10, a new simulation educator is learning the process of case design, how to design that simulation, rebriefing and debriefing, and is struggling with the concept of psychological safety. The mentor defines psychological safety as which of the following? A nice learning environment where difficult topics do not get discussed and the educator sidesteps all challenging questions. B, a learning environment where the instructor sets the stage as being instructor focused and learners can only ask questions when invited. C, a learning environment where learners can take interprofessional risks, speak up, ask questions, and discuss mistakes without fear of retribution. Or D, a learning environment where learners respect the educator, only speak when spoken to, and with hierarchy maintained. Correct. And I gave the answer out before we just talking about that one. Before we even got to number 10, when I said, don't let your teachers get in there, your faculty get in there and not train, because they'll end up turning that whole debriefing session into the classroom and make it punitive, and the student's psychological safety will go out the door. C is correct. It's a learning environment where learners can take interpersonal risks, speak up, ask questions, and discuss mistakes without fear or retribution. It is a reflective time of the simulation. Reflect on their behavior, on actions. A team, a learning environment where participants can take interpersonal risks, speak up, ask questions, and discuss mistakes is the definition of psychological safety. I'm sure you're going to see that one. You're going to see that somewhere on that exam, if not one time, probably 2 or 3 times, because that is very critical in simulation education, is making sure you create a psychological safe environment, but not only create it, but guess what? Protect it at all costs throughout the simulation. You're going to see that, I'm sure. A psychologically safe learning environment is not instructor oriented. So guess what? A question could be, hey, the instructor is making it all about them. They're teaching. That has already breached psychological safety. It should be what? Learner driven, learner focused. Ways that we can also protect psychological safety. Nor is it nice where participants cannot tackle hard topics. That's why it has to be psychological safe, because we should be able to talk about those hard topics. The students should feel free to talk about their mistakes and not feel like they're going to get in trouble. If that's the case, that the psychological safe environment has been breached or it wasn't established and maintained for your debriefing. And you're going to have to try to get that right before you try to proceed with that debriefing. Okay? Hard topics should be able to be discussed. Behaviors that do not promote psychological safety include demanding respect, not inviting speaking up, and maintaining hierarchy. Debriefing is a student-centered time of reflection. I love it. I have to get on myself when I'm in debriefing because it's easy to go over into the teach mode in debriefing, especially when you see and learning either developing and actually taking place in the debriefing room, or you see it not taking place. So you really have to have someone trained and have a technique that's specific to your areas. You know, some people blend techniques, some have more than one. Some do plus delta and advocacy, some straight advocacy, some do straight debriefing. Debriefing with meaningful learning and good judgment, they do require us to go through some training, and it takes time to develop and practice it as well. Plus delta is your easy one. That's one that you can do as a novice and teach that new person coming in what went well and what would you change. It's one you can also do if you're limited for time. Say things kind of happen and you just don't have a whole lot of time to keep your students there. You can get a real good debriefing with plus delta. But just knowing when to use those debriefing techniques and when not to use it. Respectful of the learner's input. That is so correct, Laurencia. What a great way to end our session tonight. It's 8:27. Y'all have done a wonderful job tonight. I think we've had 100%. I want you to put that on your quiz in your book. I saw some really good things, even though that last chapter, according to our friend Artie, was challenging. Y'all did very well with it. So any part of the session, the session we're going to do tonight is 40%, and the one we're going to do next week is still part of that 40%. I split it up. So please go back and review. If there was any questions you had to read twice or you had to think a little harder, you need to go take a deep dive, okay? But I think you've done a wonderful job. Any questions? Any questions? How can we manage and deal with the learners not completing the pre-work before arrival for the simulation exercise? One thing you could do is use it as a ticket to sim, and you put it out whenever you're introducing simulation to your students. Either go to their classroom, in their class with their instructors, and you introduce it as a ticket to enter simulation. And if it's clinical replacement, like we use in our school, they're miss a clinical, and miss clinical means unsatisfactory. So you have to put those stipulations in there. This is your ticket to sim, and you have to have it done. We also put timestamps on it. It needs to be submitted by 11:59 the night before. So we put actually some stipulations, or it's helpful when you highlight points for us to focus on. Awesome, Kara. Thank you. Thank you. I'll try to keep doing that. And if it's something I don't, you just give me that feedback. Email me. I really appreciate that. Yeah. 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 But those things are very critical. But Artie, you have to put some timestamps on it and make it part. It's work. It is pre-work, and it is part of your assignment. And you get buy-in from your faculty, they will actually help reinforce that, because they can actually embed it. If it's clinical replacement, it's a clinical. So put a timestamp on it. At the start of your academic year, you go in that classroom, introduce yourself as a simulation educator, and go ahead at that time and start talking about those things along with the faculty as they're moving forward the requirements for the course. And then they'll see the simulation and the faculty as one, and they'll see it as a unit and not a separate entity, meaning all of that is important for my grade and for me to be successful. Was that helpful? That's some of the things we do at our school. We've also embedded it in our learning management system in Canvas, so it's very accessible to the students. And when it goes in Canvas, they have to submit it. And guess what? It goes directly where you can see time submitted and everything. So those are some other things that we put in place as well to really reinforce our submission of our pre-work. Thankfully, we haven't had that as too much of a problem. We may have had one or two students who didn't. And guess what? They had to turn around and they couldn't come in because they're not prepared. And it only takes one time, one semester, and then everybody else is going to catch on. Awesome. All right. Well, it's 8:30 on the dot. I really appreciate all of you. Thank you for the interaction. Awesome. We really had a good session. We're going to have even more fun next week. Go ahead and review, and then we'll jump back in. Let me show you what we're doing next week, just so that you have it. But I just want to make sure. Oh, that's my thank you. Chapters 18 through 21 will be still in educational principles applied to simulation, which is 40%, but we'll be focusing on chapters 18 through 21. Okay. All right. I hope y'all have a wonderful week. I do owe you a couple of email, and the email would be, I will put the Word doc of the familiar terms as far as dictionary terms. Yeah, that's what I will do. And also put the teaching strategy PowerPoint in your folder. Okay.
All
All
right.
right. Have a
Thank
great night.
you. Have a
Great
great
rest of the
night.
week.
All right.
Bye.
Bye bye.